But you guys have heard it from time to time now. Hypertension, what is it known as? It's known as the silent killer. But has anybody ever asked you, why is this known as the silent killer? Why do we call this the silent killer? The name kind of explains it. For a lot of individuals, they don't have any symptoms of hypertension. Some of them don't even know that they have high blood pressure. When do they find out? After a heart attack, after a stroke, after a diagnosis of heart failure, after being told that your kidneys are failing. Unfortunately, the body is very stubborn. It will try its best to take care of things, not knowing that it can lead to something drastic as a heart attack, heart failure, kidney failure, needing to be on dialysis. So if we don't have any symptoms of high blood pressure, how do we know that we have it? How do we know that we should be treated? This is why it's very important to follow up with a primary medical provider at least once a year to make sure that these tests and among others are being treated, are being evaluated for. If you don't know that you have it, you won't treat it, and if you don't treat it, you will have something bad happen. Does it happen to every individual? Absolutely not, but enough that we need to know what this number is. We need to get closer to that goal blood pressure. And for some people, they may never reach ideal goal blood pressure, but as long as you're inching towards it, 120/80, I am okay with that. But it's the individuals who are living in the 150s, 160s, 170s and above, putting them at risk for significant demise, such as a stroke. If there are two things that a lot of people who end up on dialysis have, it's high blood pressure and diabetes. So we have to be very, very vigilant when it comes to evaluating for this, making sure that you don't have it. And if you do have it, that you're on the appropriate therapies, weight loss, nutrition selection, stress management, exercise, sleeping appropriately, and if that's not working, then medications. There's a host of a lot of different medications that we can use, but ideally, if we can, we want to utilize natural regimens such as exercise. We want to utilize management that doesn't require medications in the beginning, but if your blood pressure is significantly elevated, 170s, 180s and above, then we may want to institute medications earlier. I truly hope that each and every one of you guys know what your blood pressure is, know what it runs, so that you can get the evaluation that you need sooner and not be diagnosed with a heart attack. If you guys have any questions, leave a comment and I'll try my best to either answer it in the comments or make a video about it. Thank you.